My name is Donovan Latter. I'm a student physical therapist at Trine University, and I will be giving a presentation today over direct access to physical therapy. So let's get started. So we'll start off with the history of direct access. Direct access allows you to see a physical therapist without a referral from a other healthcare provider. Sometimes you may have knee pain or back pain of an obvious injury, such as a sprain or pulled muscle. Direct access gives you the power to decide if you need physical therapy, so you can just come straight to the source of physical therapy to get your injury treated. So this is often referred to as a self-referral. The level of access is dependent on the insurance provider and the state in which you live in. So with insurance, whether you have PPO, POS, HMO plan, those are varying on the amount of restrictions you have to get direct access. PPO, or your preferred provider organization, has the least amount of restrictions to get direct access to physical therapy, and then your HMO, or your health maintenance organization, usually has the most restrictions if you're able to get direct access at all. And then your POS, or point of service provider, or your point of service plan, is somewhere in between. All 50 states as right now, plus the U.S. Virgin Islands and District of Columbia, all have direct access right now. Back in 1957, Nebraska was the first state to allow direct access, and then 2016, Louisiana was the last state to join the parade of having direct access. Within direct access, there are 3 different levels. You have limited access, access with provisions, and then unrestricted access. There are 2 states with limited access right now, Alabama and Mississippi. So with limited access, you have access to evaluation, fitness and wellness, and limited treatment only to certain patient populations or under certain circumstances. So you can just go to your state's bylaws regarding direct access, and they'll lay out the different restrictions you have to get in direct access. There are 27 states plus the United States Virgin Islands and District of Columbia with access with provisions. On the map over here, the states in the pink, those are your states with access with provisions. So what that means, you have access to evaluation and treatment with some provisions such as time or visit limit, or referral requirement for specific interventions such as dry needling, spinal manipulation, or EMG needles. As you can see, Indiana is one of those states with access with provisions. So one of those provisions is you can see a physical therapist direct access for 42 calendar days. And after those 42 calendar days, you have to get a referral from your physician to keep seeing the physical therapist. And then there are 21 states with unrestricted access. So your states in blue here, those are your states with unrestricted access. My home state of Kentucky is one of those states with unrestricted access. So what it means is what it sounds like: there's no restrictions to getting any kind of direct access to physical therapy, as long as the thing you're being treated for with the physical therapist is within the scope of physical therapy. The national effect on physical therapy: many conditions can be successfully evaluated and treated with no expensive medical tests. So healthcare right now is very expensive. It seems that with every passing year, it gets more and more expensive. So a system that allows the patient to directly seek the services of a physical therapist can help save you some money. You can do that by having less healthcare provider visits, less unnecessary tests, and less referrals to other specialists. This also can help decrease the risk of illness exposure. So by seeking physical therapy first, you benefit by not needing to enter other primary care facilities or urgent care centers or emergency departments, which house common things like the flu, COVID, common cold, stuff like that, which can increase your illness exposure. But also, it kind of frees up appointments for those who are sick and actually need the services of those providers. And then the daily impact of PT practice, it has the patient satisfaction scores are higher. So direct access kind of enables the patient to take charge of their healthcare journey, which leads to higher satisfaction and engagement rates. The patient-centric approach can significantly enhance the reputation and appeal of your practice. It increases your operational efficiency as well, It does this by having quicker initiation of the treatments for your patients and also better utilization of your practice resources. So practices that offer direct access services can differentiate themselves in a competitive marketplace. And by highlighting the ability to see patients without referrals can be a key marketing message that attracts patients seeking immediate care. So if your practice offers those direct access services, are more likely to come to your practice rather than a different clinic that doesn't offer it, where they would need to go see a specialist or the primary care provider to get a referral. So for patients that want to be seen really quickly, they can come straight to your clinic if you offer the direct access. So in return, more patients, more money for your clinic. And that is it. If there was an audience, I would ask if there's any questions, but there are no audience, so no questions. So that's it. Thank you.